patient. Hi. Very nice to meet you. My name is Dr. Matt. Excellent. Okay, so I think I have your chart, but before we begin, can you please verify your date of birth? Okay. You're a little bit off by 1 day, but I'm sure I have only one patient with your name, so it must be okay. Then can you please tell me today's date? Okay. I'm so sorry, today is not August 21st. It's September 28th. A little bit off by 1 month. Okay. Alright, so it's a little bit hard to verify your chart today, but can you please tell me a little bit about what happened? Okay, a concussion can explain everything so far. So, when did that happen? 2 weeks ago. Okay. Do you have any allergies? Well, in my chart it says that you're allergic to penicillin, and you're saying you're not allergic to anything. Are you sure? Okay. Well, thanks God we have a picture attached to your chart, so I'm sure that it's you because you don't have a twin. Okay. And alright, it seems pretty straightforward since you're having neurological symptoms like forgetting stuff, and you also had a concussion. I think today we're going to do a cranial nerve examination. Basically what it is, we're going to test all 5 senses. We're going to focus on your vision, hearing, facial sensation, smell, and taste. Okay. Now, since you say you're not allergic to anything, and I do have here only penicillin, I'm not going to give you any penicillin, that's for sure. But otherwise, I am going to have you smell some things and taste, and hopefully we're not going to have an anaphylactic shock here, but let's cross our fingers. Okay. All right, let's go ahead and begin. Are you having any pain right now? Okay, that's good. And are your headaches on and off? I see. Let's go ahead and take your blood pressure and see where that is. Do you have an arm preference? This one? Okay, great. Alright, so go ahead and put your sleeve a little bit higher for me. Thank you. And I'm going to just wrap this around your arm. Great, just like that. Okay. Can you please uncross your legs for me? Thank you. Okay. Blood pressure is a little bit elevated. It might explain your blood pressure, your headaches. So let's go ahead and see what else we find that's wrong. Okay. Do you have any flu-like symptoms in the last 48 hours? Okay, so I'm going to go ahead and take your temperature. I'll put this on your forehead. Go ahead and relax. Good. Just for another second here. Okay. 99.8. It's a tiny bit high. You know, anything above 100 is considered a fever. So you're right over there. I'm going to take your oxygenation, then I'm going to retake your temperature, make sure that it's not too elevated. Okay, I'm going to put this on your index finger. Go ahead and extend that for me. Great. Good. So go ahead and relax. Take a deep breath in. Good. Okay. Oxygenation is 93 percentile, right at the border. Anything below 93, I would be very worried. But I guess, you know, your lungs are working a little bit too much. I'm not sure. And your heart rate is also a little bit elevated. You know, all your vital signs are kind of wacky today. Now, the last time I saw you, you were doing fine. And your vital signs right now are not doing that well. Let's go ahead and see what else we find, okay? Now, I did promise that I will take your temperature one more time. Okay, go ahead and relax. Okay, yeah. So it is 99.1. It's not it's not a fever, but I'll take it as a fever because a normal person should not have that high of a temperature. I'm going to go ahead and listen to your heart and your lungs now. Is it okay if I put my stethoscope underneath your shirt? Thank you. Okay. You don't need to take a deep breath in for this. Breathe normal. Okay. Breathe normal. Okay. Okay. I'm going to go ahead and listen with the bell now. Okay. And I'll slide this right underneath your shirt. Good. Okay. Okay. I think I was able to hear a cardiac murmur. I'm not a cardiologist, I'm a neurologist. So we are a little bit trained into identifying cardiac murmurs, but I'm not 100% sure. I'll be honest. You know, it's okay to admit when you're wrong or when you don't know. I'm going to write a referral to cardiology after this, just to make sure that, you know, I did not catch something abnormal. Okay, let's go ahead and listen to your lungs. Now, take a deep breath in for this. And breathe out. Good. And again, take a deep breath in. And breathe out. Okay, so I am hearing some extravesicular sounds, which should not be there. Let's go ahead and listen to the sides. Take a deep breath in. And breathe out. Okay. And the other side, take a deep breath in. And breathe out. Okay. You don't have asthma as listed in your medical records. Okay, but I am hearing classical symptoms of an asthma exacerbation. Now, I'm not sure if this is new or when exactly happened, but I am hearing some wheezing and some bronchi sounds. Not good. Alright, so I'm going to send you to a pulmonologist, also along with a cardiologist. Yeah, unfortunately, you're going to have lots of medical appointments this month. Okay, part of the exam is to just check your scalp, make sure that I'm not seeing anything abnormal. Okay, Sometimes very little insects could cause neurological symptoms as well, and they're like parasites. You don't even know you have them until a doctor or a medical professional finds them. Okay, I'm going to go ahead and check your scalp now. Okay. Okay, well, I couldn't find anything on this side. Let's go ahead and check your other side now. Okay, one more time. Okay, I was able to find something. Is it okay if I try to take it out? Okay, give me 1 second. Let me find my utensils. Okay, I'm gonna need you to stay as calm as possible and still, because I need to take that insect whole. I don't want to break its legs or part of the body. Make sure that I'm taking it all. Okay, I'm not gonna show it to you, no worries. Okay, no worries. We're going to discard this and just send it to the lab, to pathology, to have it tested. Okay. Now, I'm sure you had no idea about the existence of that parasite on your scalp, correct? Yeah. Like you couldn't feel any itchiness or anything like that. It's expected. Okay, so we're gonna go ahead and send this to pathology. I'm gonna test it and see if it comes back negative for any viruses and anything abnormal. Okay, I'm going to do an eye examination, basically just check your pupil constriction, dilation, and your vision. Okay, so what I'm going to do is I'll flash a light in your eyes. It's going to be a little bit uncomfortable. I apologize in advance for that. It's going to be just for a second, okay? Okay, so I'm just going to go ahead and define your field of vision. So your pupils are round, but they're not constricting equally. Now, that could really signify a lot of reasons. There might be some of the imbalance that you're having inside the brain, chemical imbalance, hormonal imbalance. I know I'm not saying the right words, so let's go ahead and just check further, make sure that neurologically there's nothing else going on. Okay, I'm going to do an optic nerve examination. For this, I'm going to have you look behind me. Okay, can you look right here? Okay, no worries. Wherever you can, just try not to look straight at me, okay? Okay. I'm just going to go ahead and come very close. I don't like the scratch that I see behind your retina, I'll be honest, so that's not good. Let's go ahead and check your other eye now. Can you please look behind me, straight at the wall? Okay. I'm going to do the same thing, alright? Go ahead and keep on looking behind me. I'm seeing some redness. It doesn't look that good. Now, I was hoping to see that everything is within normal limits, but I do not like the redness and the scratch that I see behind your retinas. Now, do you remember having any other accidents besides the concussion? No. Okay. And you're not wearing contacts, right? No, this is very strange. Okay. All right, we're going to do a color deficiency test. I'm going to need you to identify these numbers. Okay. Can you please tell me what number this is? 21. No, this is 12. Okay, let's go ahead and can you please tell me what number this is? It's not 9, it's 6. Yeah, okay. Can you please tell me what number this is? 75? Okay. Okay, no, it's not 75, it's 57. Well. Alright, now this one for sure is going to be easy. Can you please tell me what number you see right here? Okay, so yeah, this one was 9 and it's not 6. Okay. Go ahead and check your vision with the Snellen chart. I'm gonna have you hold this just like this, and perfect. Okay, can you please tell me if you see this last row right here? Okay, and do you think you can read it for me? Okay, can you please start with the first letter? Okay, no, so you're actually seeing this row. CFDHJ. Yes. Now I'm asking you to take a look and tell me if you can read the row underneath the C, okay? You can't see it. Okay, let's go ahead and check your peripheral vision. I'm gonna cover one eye and you do the same thing, cover the same eye, okay? And now I'm gonna have you tell me when you see my fingers in your field of vision. All the way here. All right, that's not good. Let's go ahead and switch eyes, okay? And same thing, tell me when you see my fingers in your field of vision. Now. All right, so that was a 3 seconds delay in both eyes. Okay, can you please tell me if you're experiencing any blurry vision? How many fingers do you see? 2. Okay, so that was good. Now, can you please tell me how many fingers you see? 6. Okay, so that's just 4 fingers I'm holding. So you're definitely having some blurry vision and some peripheral vision loss. Okay, I'm going to check your neurological responses, your reflexes, and I'm gonna have you relax your jaw just like this. Okay, perfect. Okay, so that was easy. You can do that. Okay, not the response that I was expecting. I'm gonna go ahead and move down the body. Tell me if you feel any kind of pain, tenderness. You feel pain there? Okay. What about here? Pain. Okay. And what about here? Also? Okay. And here? Okay. So you're experiencing a lot of pain. Okay. I'm gonna go ahead and check your neck for any lymph node enlargement. Okay. Go ahead and relax for me. Okay, that looks good. I have a few tests that are going to identify if you're experiencing some smell loss or taste loss. Now, have you noticed like coffee tasting like onion, or some abnormal taste disorders like that? No. Well, that's why you're here, to check. So what I'm going to do is I'm going to put 1 drop on your tongue. Okay, and I'm going to have you identify the taste. tastes like butter. Okay. It's definitely not butter. I have here coffee, so it should be very straightforward. Like everybody knows what coffee is, but you're tasting butter. Okay. Let's go ahead and check your smell. Alright, so this is a very easy one and you should be able to identify it. Can you please take a smell? Take a deep breath in through your nose. Good. Okay. What does that smell like? It smells like onions. Okay. Well, definitely not. This is lavender and lemon. So if you would have said any of those answers, I would have taken them as correct, but unfortunately that was wrong. Okay, let's go ahead and try one more. Okay, go ahead and breathe in, breathe out through your nose. Make sure that you are very carefully sending the signal to the brain. Okay, concentrate. Hopefully this time you'll say the right answer. Okay. Yeah. Fortunately, no, it's not strawberries. It's lemon. Yeah. Okay. Okay. Are you experiencing any hearing loss? Have you noticed anything coming out of your ears? No. Okay. So what I'm going to do is first I'm going to test your hearing with a tuning fork, and after that I'm going to do a whisper test. Okay. Alright, the first test that I will do with the tuning fork is to make sure that you do feel the vibration. I'll put it right here behind your ear. Good. Okay. Now, do you feel that? You do. Okay. Go ahead and tell me when it stops. Do you still feel it? You still feel it? Okay, yeah, there was like a 5 seconds delay there. Let's go ahead and do the same thing on the other side. Can you please tell me if you feel this? You feel it. Good. Now go ahead and tell me when you don't feel it anymore. Now, alright, so the good part is that the delay is equal, so that means there's something neurologically happening, not necessarily with the ears, and your nerve is sending the wrong signals. There was a 5 seconds delay. I'm going to go ahead and write that down. Okay, now before we begin the whisper test, I'm going to check your ear canal and your eardrums, okay? Okay, let's go ahead and check your other ear now, okay? Alright, we're gonna need to do further tests, okay? But don't freak out. Stay calm. You're in the right place. Let's go ahead and check your hearing further. I'm going to whisper some words in your ears. I'm gonna need you to repeat them back to me, okay? Okay, you can't identify what I said. Alright, that's not good. Alright, let's go ahead and check your other ear now. Just tell me what you heard. You can't identify the words. Okay, you could not hear anything. It was like muffled. All right. Okay. And lastly, I'm going to check your facial sensation. I'm going to use this cotton ball. And what I'm going to do is I'll touch you on your face while you have your eyes closed, and I'm gonna need you to tell me where you feel this on your face exactly. Okay? Okay. Go ahead and relax. Okay. That was on your temple, on the right temple, and you felt it on your jaw. Okay. Let's go ahead and do one more time. Okay? Go ahead and relax. Okay. I touched you on your lips. And you felt it on the forehead. Okay. So it seems like your face is also sending mixed signals to the brain. Okay. I'm going to do another test. This one will be cold or sharp. Okay. I'm going to go ahead and show you. Can you please extend your palm? Good. Okay, so this is what sharp will feel like. It's not really sharp, definitely. And this is what cold will be like. Okay, go ahead and close your eyes and tell me if it's sharp or cold. Okay. Sharp. Sharp. Okay. Sharp. And that felt cold. Let's go ahead and try that again, okay? That felt cold? Okay. I think I know what is wrong with you. Unfortunately, there were so many symptoms that checked in, and I'm going to write a prescription for sleeping pills, okay? Don't worry, they're herbal. There's no actual drug in them, and there are very few side effects, okay? Okay. Now, you're lacking sleep, and sometimes lacking sleep can really trigger a lot of imbalances in our body. Well, let me know I'll give you 3 days, okay? In 3 days, you should see some improvements. If you don't, go ahead and give me a call and I'll try to find something else, okay? There is a line of treatment, so we always start with basic, and after that we go further up, okay? All right, it was a pleasure to meet you, and thank you so much for the opportunity to take care of you today. Okay, take care now. That's a wrap.